Hi everyone, I am Prof.Manavalam working in SNS College of Nursing. Today we are going to see about the non-stress test. It is one type of non-invasive method of diagnosing the fetal well-being, and also we can early diagnose the fetal problems by doing this test. It is a painless procedure, it is non-invasive, and also no need of spending much of time in hospital settings like a OPD procedure. They can come and do this procedure and go. It is simple to do, and also it is very easy to do the interpretation in this non-stress test, and also early we can find out the complication, and by doing this test we can take the necessary intervention to prevent the further complication. Let us see about the non-stress test in detail. This is a simple non-invasive, commonly performed after 28 weeks of gestation. Why? Because this test commonly they are measuring the fetal heart rate in relationship with the fetal movement. Whenever there is a movement of the fetus, at the same time contraction of the uterus, there may be changes in the fetal heart rate. Actually, the normal baseline fetal heart rate is 110 to 160 beats per minute. It may be get changed because of fetal movement or uterine contraction. That monitor by using this non-stress test. Actually, the fetal movement is influenced by the fetal cardio as well as baroreceptors. This receptor is mediated by the fetal spinal cord. Mainly the fetal spinal cord integrity that is happening after 28 weeks of pregnancy only. For that reason, these are all the factors that has a direct impact on the fetal heart rate. For this reason only, they are doing the non-stress test after 28 weeks of gestation. The time only the spinal cord integration which will be there is a we can find out, we can confirm the non-reactiveness of the fetus by doing that. Before that and all, it is not possible because the less fetal movement which will be there, the spinal cord also is in the state of development. This test is called as a non-stress because we are not giving any stress to the mother, only we are measuring the fetal heart rate of the baby in order to with the relationship with the fetal movement. Generally, it is performed after 28 weeks of pregnancy. Before 28, because I said it is not developed enough to respond the test protocol. The duration of the procedure is 20 to 30 minutes period of time. They commonly used to do this procedure. Sometimes it may be extended to 40 minutes to 50 minutes period of time. Why? Because if the fetus is sleep in the state of sleep, means the sleep cycle of the fetus is 10 to 40 minutes. After that only the fetus will wake up and have the movement. So it is mainly they are measuring the fetal heart based upon the fetal movement. That's why they are waiting for the movement of the fetus. For this reason, the procedure may be extended to 40 to 50 minutes. Why we have to do the NST? There may be a maternal indication and a fetal indication. But at present scenario, for every mother, those who are after 28 weeks of pregnancy, clinically, most probably after 32 weeks of pregnancy, for every pregnant mother, they are doing the NST per month. Apart from that, certain indications also there. If maternal, the mother, those who are having the chronic hypertension for a long period of time, gestational hypertension, that is mainly occur during the time of pregnancy, and pre-eclampsia, along with hypertension, the mother used to have the proteinuria. The mother had the pregnancy through the in vitro fertilization method. The maternal have the advanced age. First time their mother had pregnancy in the advanced age or under age, obesity, post-term pregnancy after 42 weeks of pregnancy, any type of umbilical or placental problem, placental insufficiency, umbilical cord, single artery, or absence of artery or vein, any type of problems that leads to some complication to the fetus. So these are all the maternal indication of NST. Next, move on to the fetal indication. In case of growth restriction, they found through the ultrasound, means for that kind of baby, definitely we have to do the NST. Next, multiple, more than one fetus that is present inside the uterine cavity. Any kind of fetal anomalies, if the mother doesn't felt adequate fetal movement, means for that kind of mother, for that kind of cases also, definitely they have to undergo the NST. How the NST procedure performed? Actually, this is the right side, that is the NST machine. It has the digital monitor. In that monitor, now in the graph sheet, the results coming in a graph sheet, that is in this picture it has shown. In this graph sheet we are having the fetal heart rate, the baseline fetal heart rate, and what may be the variation in the fetal heart rate, that we can monitor by this. And also the fetal uterine contraction we can monitor, and also fetal movement. So these are the three things we are monitoring by using the NST. Sometimes only they are monitoring the fetal heart rate and the fetal movement. They are not monitoring the uterine contraction. If any necessity, means they are monitoring the uterine contraction. Otherwise, they are monitoring the fetal heart rate as well as fetal movement. So in this machine, it is attached with the charger. It has the two transducer, the round one it has given in this picture, and one pincer like probe. This probe is mainly used to mark the fetal movement. So before doing this procedure, we have to do the certain preliminary steps. We have to ensure that the mother is feeling comfortable, either by semi-sitting position or in the sense of Fowler's position, or laying down supine position. We can do this procedure, or side lying position also. We can make the mother to lie down in side lying if the mother feeling the discomfortable. So before putting the mother on the bed, we have to ensure that, make sure that mother had the food, and also mother must have the water with her, because it takes a short period of time. So mother has to have the water or any type of juices with them. Next, we have to make the mother to empty the bladder. After that, we have to make the mother to lie down on the back, and we have to apply the transducer. For that, we have to abdominally palpate, and we have to locate the fundus as well as the fetal spine. So in fundus, where we can feel the fundus, there we have to attach one transducer, and it is secured by the belt. Next transducer we have to apply over the fetal spine, back of the spine. Through that we can hear the fetal heart rate. That transducer also secured by the belt. Next we have to instruct the mother to press the even marker, that is finger like probe. We have to make the mother to press that marker whenever the mother feeling the fetal movement. So everything it will be traced out in the graph sheet. In this, during the time of procedure, if we are having the less fetal movement, the mother doesn't feel any fetal movement, means we can give the stimuli, external stimuli, like we have to make the mother to move side by side, or make the mother to have something. So like some ring, we have to we have to vibroacoustic stimulation. Any type of method we can apply to stimulate the baby in order to wake the baby up if the baby is in sleeping. So these are all the way we have to do the NST. What does the NST look for? The primary goal of the NST to measure the heart rate, the fetus in response to its movement. Through that we can know the adequate oxygen for the required physical activity is fetus is getting or not. That we can know it by doing this. Whenever the oxygen level is low, the fetus is not responding to normally. The fetal movement, it will be getting decreased. So automatically there is a variation in the fetal heart rate. How the results we can interpreted through the non-stress test. The test result interpreted as a reactive NST and a non-reactive NST. Reactive NST is considered as a normal one. This is the original graph sheet. In that the 20 minutes to 40 minutes. So one window period is considered as a one window period. It consists of 10 boxes in the graph sheet. Here the baseline fetal heart rate is 130, but whenever the fetal movement it has given in the B, the section of B, so one straight line, dark line has given, it is indicating the fetal movement. The C, it is indicating the fetal contraction. So first only in this graph sheet we are seeing the fetal movement as well as fetal heart rate. Based upon the fetal heart rate, fetal movement, there may be a acceleration of the fetal heart rate. The acceleration may be 5 to 15 beats per minute and also mainly 15 beats per minute, and it may remain in 15 seconds. Then it is considered as a normal acceleration. So according to the reactive NST, the fetal heart rate must have the acceleration in response to movement, or at least to respond to contraction. There must be a 2 acceleration that should be occur within 20 minutes period of testing time. So according to this graph sheet, there may be a 2 acceleration that is present in one 10 minutes window period. Next, move on to the next, non-reactive. It is considered as abnormal. So abnormal, it may be present in case of fetal asphyxia, fetal hypoxia, if the mother exposed to any drugs, or if the fetus is sleeping. So in the placental insufficiency or cord compression, because of these reasons there is no variation in the fetal heart rate. So according to non-reactive NST, there is no acceleration of the fetal heart rate in response to the fetal movement or contraction. During the 20 minutes testing period, it is considered as a non-reactive. It is indicating that the further investigation is needed. So we have to make the mother to rest for a certain period of time. Again we have to repeat the NST. Again the same results they are getting means, then we have to take the necessity intervention. We have to send the mother for further investigation to confirm the fetal well-being I think I explained much needed point about the non-stress test. Thank you all.